So let's talk about some privacy considerations for telehealth during COVID-19. This has been a really trying time for us. Federal and state agencies, they're trying to facilitate the use of telehealth during the COVID-19 public health emergency. And both the OCR, HIPAA, and SAMHSA Part 2 have issued guidance regarding these privacy protections and telehealth, the TIP 60, for example. So, key point number one is just that you can still take action to protect client confidential information. And this is really important because telehealth may increase both the number of people and technological systems and different companies that could have access to confidential health information. So, providers should really focus on themselves as well, avoiding public Wi Fi, password protecting devices, keeping files secure both from your family and also on your computer if at all possible. Number two, this is really important here. You can use widely available apps to support service delivery right now. The Office of Civil Rights, in their guidance, announced that they're going to waive potential penalties for HIPAA violations arising out of what they're calling good faith use of telehealth. And they've listed in their FAQ to a link to, I think it's some sort of app that can be used right now. So that does include things like FaceTime or Skype or Zoom or other texting apps. But I think a lot of people have pointed out that it's just good to keep up good habits also. And whether there are going to be penalties or not is not the only consideration for your client's privacy. So if possible, you can use different things. Some of that, Google Hangouts, or others that are listed. SAMHSA has also released guidance, and what they've said, or so they've emphasized, that providers can make their own determination as to whether a medical emergency exists. Part 2 currently permits disclosures without the consent for medical emergencies when patients' consent cannot be obtained. And not everybody is able to do an e-signature or an electronic signature. And so the example here is a medical emergency might exist where someone needs substance use disorder treatment services, but consent can't be obtained because of the COVID-19 pandemic. So providers should be documenting any disclosures. They should be keeping in mind that records disclosed under the exception no longer received Part 2 protections unless they've been disclosed. And also, importantly, this exception applies to disclosures for treatment purposes. You still need written patient consent for billing purposes. And I have spoken to at least one provider who was going to hold submitting claims until they got that written consent in person. But that's just something to think about. So let's talk a little bit more about in-person consent. In-person consent for authorizing disclosures of substance use disorder treatment information is not necessary, as I stated earlier. Part 2 accepts electronic signatures on consent forms. So we're talking about consent to disclose information. We're not talking about consent to treatment. Part 2 doesn't say anything about consent to treatment. We're talking about the sort of consent forms you get when you sign up a patient and you want an emergency contact. So you want to be able to contact their emergency contact and to bill insurance. So Part 2 permits e-signatures. Someone asked a pretty creative question about using Whiteboard and Zoom. So Part 2 only says e-signatures are permissible. There's no additional guidance. I think at this point, and I'm trying to speak very carefully because I'm not giving legal advice, I'm just sort of trying to speak common sense. At this point, if the regulations say you can't do it, then you shouldn't do it. But if you're coming up with a creative solution as a stopgap and later you're sending a physical consent form through the mail that person can sign and send back, if you're having someone helping to save someone's life by providing substance use disorder treatment, I find it hard to imagine that there would be an enforcement action right now for violating the e-signature provision of Part 2. The important thing is the client or patient understanding the terms of the consent form. So if you scroll through the whole consent form and they've understood, to whom they're disclosing the information, and then they sign with your creative whiteboard solution, it's hard to imagine that the patient later is going to complain because they would have known that they were authorizing that disclosure. And again, in the sort of current enforcement scheme, I won't say anymore, but I think creative solutions are, what we need right now. Let's see. The other thing I want to highlight here is that when you're disclosing pursuant to patient consent, so let's say that you're billing insurance or you're contacting their emergency contact, you always need to make sure that you're including a notice prohibiting redisclosure on those documents. And that notice can also be electronic, so it doesn't need to be paper. It can be an email or any electronic media as long as it's written. And finally, providers should always obtain consent to disclose to your telehealth service. If the telehealth service, whatever communication service is your thing, if it's going to have access to the patient information. So let's say, for instance, that you're using a hypothetical service that we know is monitoring all of the text information and putting that into an algorithm that they can market later, like someone may need new sneakers. If they're reading that information, then you'll need patient consent to authorize that disclosure to them because you know that someone somewhere is reading that information. So that's something to keep in mind. And that's the beauty of using encrypted, end-to-end encrypted services, because you know that the telehealth provider does not have access to that information. Point 5, make sure you're checking your state laws. If there's a state law that has more protected privacy protection, then you need to follow your state law on top of that federal law. And point 6, those same protections that you're thinking, when you're working remotely, make sure that people can't overhear you. This also applies to your patient. So the Center of Excellence is working on creating a resource that providers can give patients to help the patients understand the steps that they can take to maintain their privacy in their own setting. And another way that a client can protect their information, keeping their Wi-Fi secure, avoiding public Wi-Fis, keeping your files safe, um, password protecting their devices, finding a private space for the receipt of services, not in a crowded room, so on and so forth. So the COE-PHI is a partnership between CAI and the Legal Action Center, and they're here to help you with any questions related to protected health information and federal privacy laws. So here's how to access their services and their resources. You're welcome to visit coephi.org, where you can ask individualized technical assistance questions and also view their resource library. The resources and the services that they provide do not constitute legal advice, but it is a wide breadth of information for you, especially if you're